The gentleman from North Carolina, Mr. Butterfield, for 5 minutes.
I thank the Speaker. Madam Speaker, I rise today to announce to my colleagues the formation of a new House caucus to be known as the State Medicaid Expansion Caucus. I am delighted to co-chair this caucus along with my good friend, Congressman Hank Johnson from the state of Georgia. Madam Speaker, this caucus is 33 members strong. We want to demonstrate to recalcitrant governors and state legislatures across the country the overwhelming public support for providing health care to low-income single adults, particularly those ages 18 to 65. The majority of our caucus members are from states that have made the short-sighted and politically motivated decision to exclude the very people the Medicaid program was established to help in the first place. To date, 26 states and the District of Columbia have seized the opportunity to expand coverage to millions of Americans. These states made the wise and moral decision to not only ensure that their residents can get the care that they deserve, but they made a smart economic decision to pull billions of dollars in additional federal funds. These funds have the triple benefit of yielding better health outcomes for the low income and poor, creating health care related jobs, and driving down the aggregate cost of health care over time. In contrast, 24 states have not yet expanded Medicaid. They have irresponsibly chosen to turn their backs on more than 5 million Americans that need this coverage. What are those 5 million Americans going to do when they get sick? Well, what are 500,000 North Carolinians going to do when they need medical care? Well, Madam Speaker, I would tell you what they're going to do. They will either not seek the treatment that they need, causing their condition to get worse, which will lead to missed work and therefore unable to pay their bills. Ultimately, they will find themselves in a much worse situation than if they had coverage that they deserve. The other option is that they will do what many uninsured people have always done out of necessity: go to an emergency room, be treated, and walk out with a bill that they have no ability to pay. Hospitals will then write the cost of treatment off as uncompensated care. In order to recoup some of the lost money, hospitals will then increase the cost of their procedures, which results in higher premiums for the insured. Medicaid expansion isn't just good for our insurance premiums, but it's also good for the state's bottom line. In North Carolina alone, expanding Medicaid will save the state more than $65 million over the next 8 years. Expansion would benefit our economy in North Carolina, adding nearly $1.5 billion to the state's revenue. North Carolina drug makers and medical device manufacturers will need to expand their workforce, adding a total of 23 jobs to the state. That's just in our state. The benefits of expansion nationally are far greater, yet the same scenario is playing out in nearly half of all of the states. 24 states' decisions to not accept billions of dollars in federal support defies logic and will prove catastrophic for the very people the Medicaid program is intended to help. A critical point that many people overlooked is the fact that under the Act, the federal government will pay 100% of the cost of expansion through the year 2016 and 90% of the cost thereafter. The public demands actions in states that have not expanded, and members of this caucus are tired of inaction. We are disgusted that these states have such callous disregard for poor people. We will continue to press this issue until all 50 states have expanded their Medicaid program. Again, I thank Congressman Hank Johnson and the 31 other members of the State Medicaid Expansion Caucus and the many advocacy organizations for their courage to fight for those who are being blocked from the most basic level of health care. I thank you for the time, Madam Speaker. I yield back.
The gentleman yields back.